Hey guys, welcome back. So today it's going to be a very unique and a very different video. I'm not going to talk about what to do for the NEET PG, what to do for the upcoming FMG exam, or what to do if you are not done well in INST. Neither I'm going to talk about how to write an exam paper for MBBS. I'm going to talk about particularly a very important thing to which all of us are trained to, the job. The job market across the world, across every domain has become very brutal and competitive, especially with the introduction of artificial intelligence. So what should we do? How should we be prepared? We should we stick to the routine thing of complete MBBS, then do a NEET PG, go to specialization, become a consultant, senior consultant, surgeon, medical, whatever field it is. Is that the only path available for doctors, or is there anything apart from that which a doctor can do with their existing clinical knowledge and ace and become leaders in that segment? If you're first time here, do not miss to subscribe to the YouTube button. And I'm Dr. Ranjith, your pathology faculty at PW. Let's discuss more about medicine and healthcare as a whole. Now let's come back to the topic. Like I said, the job market. What are the new avenues artificial intelligence is created for existing doctor pool? Because as you know, by this time, the amount of doctors which my country is producing is increasing tremendously. So some of you might not have a perfect fit in future sitting in a clinic or a hospital. So should I be restricted only to that? Not at all. There are going to be very particular niche areas which requires your knowledge and your expertise. I'm going to number it down. Please listen to it very carefully till the end. The first thing I'm going to talk about is an clinical AI consultant. So what does it mean? See, what does, if you look at Google, if you look at OpenAI, if you look at Anthropic, if you look at any major platforms, they are trying to come into medical field saying that they'll be able to provide diagnosis. But obviously, when I'm going to give you clinical history, the AI knows books, but they don't have the skill yet to kind of understand, to correlate, and to give a final diagnosis. So, in order to train them, in order to train the models, in order to refine the diagnosis, they need a medical support, they need a medical knowledge by default. Yes, and you guys who have the existing medical knowledge will be actually cherry on the top for any of these companies who's trying to ace the art of clinical medicine, right? So clinical AI consultant is going to be a very important role in most of the health tech startups, which is going to be there in a ambitious target of able to diagnose without the intervention of a human being. You can be one of them who might be leading the change, right? Next is about health informatics specialist. So what does health informatics mean? See, if you look at informatics, informatics is nothing but processing data. You must have definitely heard about electronic medical records. The in your college, you enter all the patient details, everything, right? Or be it digital pathology slides, or be it an X-ray where you have the PAC system, MRI, CT, right? So there's a huge amount of data coming inside. So software engineer and a bioinformatician might be able to know how to process the data, but they might not know which is important where. A male with a thyroid swelling is very important, right? Because very unlikely in a rare finding, right? So that is where the expertise of a medical professional will help. So you can be the person at the juncture who is going to tell, yes, this data is good for me to get to a fruitful conclusion. No, this data is not good for me, let's scrape it off. You will be the decision maker there, and that's the health informatics specialist, right? Third one, like I just said in the just few minutes ago, lots of slides have been digitized these days. So there should be someone who should be there to mark, okay, this is a cancerous area, this is not a cancerous area, let the machine learn towards it. X-ray is there, okay, this is most likely a cavity, this is not a cavity, might be a tuberculosis, this might not be a tuberculosis. CT is there, it could be an, yes, it's an hemorrhagic infarct, ischemic infarct. Someone has to annotate, someone has to tell the system, see, this is what it is. And that's where this is actually a very golden opportunity that quite a few number of medical startups are looking for people who are good in annotation that will help the AI, artificial intelligence system learn better and help the future doctors to diagnose faster and with ease, right? That's the third one. Next is digital health startups. There are lots of digital health startups. Just Google digital health startups. In the past 1 year, many of them has mushroomed. In all of them, when I say digital, most of them are run by software professionals. Where is the health part? Obviously, you need a person to liaise in the job of the digital health person and the customers who are obviously the people. So you are actually the bridge here between the digital and the health system, which will actually make the digital health startup work. But a caution here, just don't be a signature officer there. Just don't be a license officer there. Learn, involve and make sure you're part and parcel of the ecosystem. That makes your position in every digital startup very strong and just not for the paycheck, right? Next, you can be actually a preventive health and a public health specialist. There is very less time, I feel that in very near future, good amount of countries, states might include doctors who will be able to predict what will happen to the healthcare, be the vaccine failure rate, be the cancer progression rate, be the epidemiology, be it any new disease epidemic. You need someone with a medical expertise with the help of the AI models, which can help me predict the future for both communicable and non-communicable disease. Who knows? WHO might start a new one and you might be a pioneer of that, right? Last but not the least, medical entrepreneurship. I feel that India is in an age of pivoting from a routine job to an entrepreneurial era. And with AI, you just don't want a big company to succeed things. You just want a person tirelessly working towards a single aim with the help of artificial intelligence. You can use that and give life to your ideas, which is just ideas last decade could become a reality in the next decade. And AI can help you do that. All these are the options, and this is just the tip of the entire mountain. Just go deeper. There'll be much more options available for every medical professional. It's not that I'm telling you, okay, leave clinical medicine, go here. These are the options which are available, and I'm sure you'll make use of that. And a very important caution here, don't think that if I'm going to feed the system these, system will eliminate me. I'm very bullish on AI, and I still believe there's lots of time left before an artificial intelligence system can automatically diagnose and treat patients. I don't think it'll happen in near future, and even if it happens, it'll happen without you as well. So make hay while the sun shines. Right? That's all from me. If you have any comments, put in the below section. Let's definitely make sure our entire community goes up high and proud in this, even in the era of AI. Medical and healthcare will never be abolished. It will be augmented with help of AI. Thank you. Bye bye.